Good morning. There's something on my mind that I've been wanting to share for a few weeks, and so I'm going to give it a shot right now. I have a heart condition that I've known I've had for 25 years, but no one really gave it a name until this year. And I had a, a big assortment of tests done to get the diagnosis. Uh, that's not the reason for this video. The reason for this video is part of um, the tests that had to be done was a lipid panel. And for those of you who don't know, that's having your cholesterol checked. I have some pretty strong opinions about cholesterol tests in general and the statin drugs that are prescribed to everybody my age. And it's a serious situation. I've seen people who felt fine go to feeling miserable in just a few months. People's bodies start to ache, their mobility is limited, their memory starts to decrease, and it's serious. Often it leads to full-blown metabolic syndrome, where people are gaining a huge amount of weight. They are pre-diabetic where they weren't diabetic before, and the medical system just scratches its head and then makes you feel guilty because you're not losing weight, which is part of the protocol, but the drugs themselves cause you to gain weight. I've seen people that I love and care about get very, very ill because of statins, and I had a feeling that given my diet, which is a high-fat, low-carb diet, that I was probably going to get a pretty high reading. But my cardiologist wasn't prepared for what happened next. So I had the test done, and I got the results, and before I'd even looked at them on my portal, I got a call from his nurse saying that that my low density lipoproteins, my LDLs, what they call the bad cholesterol, was twice what it should be, and that the doctor prescribed Lipitor, and that it was at the pharmacy and I could go pick it up. And I said, well, I'm not picking it up. And she said, why? And I said, well, for one thing, I haven't even talked to him yet. So after I talk to him, then we'll see about picking it up. So I had an appointment to see him 2 days later. And in the meantime, I did some research. I looked up the numbers and what they meant. And I had a pretty good idea. But my HDLs, the high density lipoproteins, which they could call the good, which there really is no good or bad, but they like to give it a name. And those were great. They were perfect. They were beyond perfect. The triglycerides were super. And the problem with the tests that they give you, the standard test that Medicare covered and most insurance companies cover, doesn't define the low density lipoproteins as to whether they are small dense particles or whether they're the large buoyant particles. And so they really have no way of knowing whether you're at risk for a heart attack. So sure enough, I had my appointment a few days later, and he said, I see you haven't picked up your Lipitor. And I said, yeah, I'm probably not going to do that. And he kind of got angry, and he said, why? And I said, well, for one thing, the test that you gave me doesn't differentiate which type of low density lipoproteins brought this result on. And my HDLs are great. My triglycerides are awesome. I know what my diet is. I don't think I have high cholesterol. And high cholesterol doesn't run in my family. And unless you can give me a test that differentiates between the different types of low density lipoproteins, I'm not going to take the statin. And he got angry and he yelled at me. And I listened to that for a minute, and I said, you know what? I didn't mean to make you mad. But this isn't about you. This is my life, and I've seen people suffer and have their lives ruined because of statins. So I would like the VAP test, the NMR test, or something that's going to differentiate and tell me which type of HDL or LDLs we're concerned about. And he got a little more flustered and eventually kind of settled down. And I found out something interesting too, that they are mandated. They are the standard of care that doctors have to abide by is a certain percentage have to be prescribed statins, whether they need them or not. And it's the biggest money-making drug out there. So I stood my ground and I demanded a different test. And he said, well, they don't do the VAP test anymore. You can get an NMR test and I'll write you a prescription, but Medicare probably doesn't cover it. And I said, I don't care. I said, I can go online and order the test and go down to the local lab and have my blood drawn and pay for it out of pocket. It's $99. So I was kind of had that in my mind to do anyway. And he said, you know what? And at this point, he started to settle down and he realized I might know what I'm talking about. And he backpedaled a little bit. And he says, you know what? I can do one better than that. There's a test called the CT calcium scoring test that'll determine whether you're at risk for heart attack or not. And our local screening place does them. It's a CT scan, but Medicare doesn't cover it. It's about a $400 or $500 test, and Medicare doesn't cover it. But this local center wants everybody to have the test. So what we can do is we can submit it to Medicare. They'll deny it, and then you can make an appointment. They will do the test for $100 out of pocket. And I said, great, sign me up. I'm all over that. And so that's what happened. A week later, I had the test, and I waited a little while longer before I got the results. And guess what? I scored a 0. A 0 is the best score you can get. You're at absolutely no risk for heart attack. So I guess my message here is don't fall for the standard test that they give you, because it doesn't differentiate. And it doesn't tell you whether you're at risk or not. So I'm trying to keep this short, so I think I'll just stop right here, but you can message me if you have questions. So hope everybody has a great day, and I hope to talk to you again.